As Min-jung just mentioned, from the end of this month, COVID-19 will no longer be classified as the most dangerous disease in South Korea. This means people who get infected will no longer have to stay at home for 7 days. There'll be a lot of other changes, too, in the way the virus is dealt with. Bae Eun-ji has the details.
Starting late May, people who test positive for COVID-19 in South Korea will no longer have to go through the week-long mandatory quarantine. They will be also able to receive treatment at local clinics and hospitals, just like any other disease. This also means that the country will no longer cover the medical costs in full for COVID-19 patients.
The 7-day mandatory quarantine will be lifted and the requirement for at-home recovery will also be removed. Medical costs will be covered by the National Health Insurance Program and patients will be responsible for paying them. But non-face-to-face treatment services will still be in place for those in need.
This is because COVID-19 will no longer be categorized as a level 1 infectious disease. Starting April 25th, it'll be downgraded to level 2. Then, after about a month-long transition period, South Koreans will slowly be able to go back to normal. Also, starting June, travelers entering South Korea will only need to get a PCR once, on the first day of their arrival. This will also apply to those who are not vaccinated. But travelers will still need to have a negative PCR test within 48 hours before departure. Right now, overseas travelers have to take a PCR test on the day of their arrival and then also take a rapid antigen test about a week after they have entered Korea. Bae Eun-ji, Arirang News.